Welcome back to Community Calendar. I'm excited to have Dr. Bill Hankey and Adrienne Buboltz with me today, and we are going to be talking about the Rotary blood screening, and that's an event that's been on a long time, hasn't it?
We don't know exact number, but I think it's in the 30s someplace. Yes, was a friend, Dave Knutson, came back from Florida Rotary, and they had this project down there, so he came back and said, I think this would be a good fundraiser for us. And luckily, the hospital is very willing to work with us on it. We've had great administrative assistants over there that take the ball and run with it and they get them organized, and then I just have to get the crew together, get the word out, and it happens.
Yes. So what is happening at the Rotary blood screening?
Well, first of all, the dates of the event are September 13th through the 15th. They'll be at the Essentia EMS building, and it runs from 7 to 9:30 a.m. And we will have a pretty good complement of blood testing as we've had in the past, and we can maybe talk about the specifics with that in a bit. But it should be well represented, and has certainly been a popular event in the past, for the citizens of DL.
Yes, I've done it several years, and it's nice to get those results back. And is there anything that people have to do prior to coming to get screened?
You don't want to eat or drink, you don't want to drink coffee with cream in it or anything like that. It's really good to fast for 10 to 12 hours beforehand. You can have some water if you need it or take your pills or something. But just a good idea to fast. Otherwise, the numbers will be skewed, and you really won't learn what you want to learn. So.
Sure. And then afterwards, people have a little snack, right?
They have what? Little treats. Yep. We have some coffee, we have some juice, and we have some muffins, and and we are all happy to see you. We want as many to come as possible so we can keep this project going. If we don't get the numbers, then the facilities may think, well, I guess this has gone past its thing. That little break we had because of COVID, which affected a lot of things, kind of affected that. And then a couple years, they only could do a couple tests, but then we figured out a different way to bring it all back. So there's the full panel, I think you could say. Is that right, Dr. Hankey? I think the full panel is back that we had before. So it's really worth it. This would cost a lot of money if you had to pay for it out of pocket. So it's...
And what is the cost here?
It's $40.
Yes.
And then you get all your results online. And you can, I'm a Sanford patient. I probably shouldn't say that online. But anyway, but my results, I can just link it over from Essentia to Sanford, and it looks like I just had it done there. Yep. So it's just as...
Yeah, it flows right to your chart. I mean,
mm-hmm.
Yes. Yeah, and it's really a well-oiled machine. You walk in and you're really directed where to go, and it does not take very long.
No, that's our goal, is to keep people are busy. They want to get back to work. They want to do other things for the day, and they want to get their treats. And if you go without coffee or those things, you kind of get ready for it.
Sure. And I think the year of COVID, I had it done not through the Rotary because they didn't have it, and it is way more expensive. So what do the tests tell you?
Okay, well, first of all, we have several different components to the panel. The first one is the lipid aspects of it. And so what that covers is total cholesterol, the HDL or good cholesterol, the LDL bad cholesterol, and triglycerides. And these can be very helpful in helping individuals detect their risk for cardiovascular disease, so heart disease, the risk for stroke, those types of things. COVID did skew things for a while. But heart disease is still the leading killer of men and women across all ethnic groups and racial groups in the United States. And some of the key risk factors are abnormal cholesterol results, high blood pressure, tobacco use, diabetes. And so that's kind of a good lead-in. We also have a serum glucose on the panel, which can be a very nice screen for diabetes. In the United States, diabetes is becoming more and more and more prevalent, including in our young people. And the interesting thing with it is that there's a very big population of pre-diabetics out there. So, for instance, on this, if you wind up with an abnormal blood sugar, it could give you a nice tip-off that you're headed in that direction. And if you work with your medical provider, you should be able to devise a good action plan to maybe nip it in the bud. Another real important one is the hemoglobin, which is basically an assessment of your red blood cell status. And so sometimes people with anemias will be found to have, unfortunately, things like hidden cancers or ulcers or other disease with it. So I think the key point with this is that it's a great opportunity for you to be provided with information in an easy setting at low cost, and then just be able to take that data to your provider and come up with a nice plan that's groomed for you.
Yeah, and in the past, we would get a copy mailed to us. Is that still the case, or does it go right to your electronic chart?
It's electronic. A lot of things are happening that way these days, you know. So it speeds things up. It makes it most cost-effective way to do it. So I know a lot of people miss that, but
sure,
this is the way things are going.
Yep. Nope. And I know, and you know, it is easy to read as well. You know, I'm just for a layperson to look at it and say, oh, those are in the normal range.
This is where you should be, and this is where you are. And,
yes.
and so you can really feel good when you're in that normal range, and you kind of go, ooh, maybe I got to talk to somebody about this one.
Yes. And then now this is noon Rotary, correct?
Yeah, yes it is. And, I might also make another comment. A couple other components of the panel are screening for kidney disease, liver disease, as well as potassium, which is kind of one of the body salts with it. So it really does kind of cross the board well, with that. So
Super. So that is the noon Rotary blood screening. And Adrienne, give us the dates.
September 13th, 14th, and 15th from 7 to 9:30.
All right.
So we look forward to seeing you. And sometimes people come in and say, oh, I haven't seen you since last year. But, we're there. We're ready to greet them and get them through so they can get back to wherever they want to be doing.
Yes, and that's at the EMS building by Essentia Health on the hospital side area. I'm not exactly sure the street, but I think you can get to it through the parking lot of the hospital, and there's a street.
Right across from the Holiday Station.
I think it's on McKinley, just off of McKinley Avenue, so it's really easy access.
All right, so make sure you do that. You just fast a little bit before you come, and it's really, really an easy process. So thank you so much for joining us on the community calendar, and we'll be back right after this.